Sensational Saturday, everyone. Welcome to a new edition again of the Divorce Dynasties, the D word. Wow, this is going to be really a life changing show for you because obviously it's New Year. We're always looking for new ways to look better, feel better, get healthier, and most of all, embrace our new beginnings. Today, our guest is multi-passionate, multi-talented, super brilliant in so many different aspects, from the field of medicine to facial artistry, as well as health and fitness. Well, Dr. DiMaggio, we're going to be introducing you in just a little bit later. But first of all, I'd like to also welcome you to this show, my co-host, the beautiful, vibrant founder of Divorce Dynasty, Carolina Denhard.
Hello, everybody, and Happy New Year. I can't think of a better way to start the new year than to talk about wellness. And, wellness comes in so many different facets. It's your brain, it's your mind, it's your spirituality, it's your health. And our guest today, Dr. Richard Maggio, is somebody that I've known for many years, I've had the pleasure of working with, who is part of the Divorce Dynasty platform, and who understands the interplay between feeling good and looking good, and how that is so important when you are kicked in the gut by a life experience, and how that sometimes is what you need to take the first step into a new chapter.
Yes.
Well, Dr. Maggio, you are multi-passionate, just like what I said, from urology to facial artistry and in the medical form, right? And now in shock room fitness.
Yes.
First of all, talk to us. Who is Dr. Maggio? Talk to us a little bit about your background on how you have basically crossed over to different genres of medicine and health and wellness.
Well, I started as a urologist, and I'm still a urologist. About 15 years ago, I had wanted to open up a spa for men because as a urologist, I could provide, along with aesthetics, which I learned how to do, I could provide testosterone replacement and erectile dysfunction, because at that time men didn't go to med spas. So I thought it was a niche that I had, and that kind of developed into About Face by Luminous, which is for everyone. So we do a lot of new techniques. We use cool sculpting. We use fillers, neurotoxins, Botox and Dysport. We do Morpheus. We do Votiva. And we do things to make people look and feel good. One of my clients about a year or so ago, who was a fashion model, told us about this new technology that he uses to work out, and this EMS suits, and that's how we got into shock room fitness.
So shock room fitness sounds scary, right? It's like you're already shocked by whatever happens to you in life, but now you're in some room and you're getting shocked. People have a lot of misconception about what this is.
Right.
Dr. Maggio, tell us exactly what this type of exercise program looks like.
So basically, it's kind of a workout on steroids. Basically, what we do is you put on a suit. It's a neoprene suit, and it looks like a dive suit. It almost looks like a dive suit, and it has all these electrodes in it. And the technology is similar to TENS, if anybody's familiar with that, where muscle stimulation is used in physical therapy to help with rehabilitation. So this suit is put on, and it has electrodes that stimulate every muscle group. And with a handheld device by the instructor or the trainer, via Bluetooth, the frequency and stimulation of each of those electrodes can be changed, so that with a 20-minute workout, it's equivalent of getting a 3-hour workout conventionally.
My kind of workout.
Yeah, right.
So is this a situation where you are not lifting weights, you're not on an elliptical, you're not using other machinery?
So you can. So normally when you work out, the brain tells the neurons to fire and your muscles contract. The beauty of this is that the body can't differentiate between an external source and your brain. And when the muscles get stimulated to contract, they contract. So if you do it from an external source, the amount of contractions that you can do is unlimited. So you can do this with a workout. You can do this sitting down. You can do this. With isometrics. So that's the beauty of it. Anybody can use it. What's also good is that people who have some joint injuries, or they have areas that they can't work out, the muscles surrounding these areas could be worked out passively without them having to do anything.
Wow, you basically you have almost integrated physical therapy with it. Is there any medical concerns for people before they get into this? Do they need clearance from their
Yeah,
medical?
every first of all, people should be in relatively good health. There are certain contraindications to it. Anybody that has some cardiac disease, any arrhythmias, people who have implantable devices, and people who have uncontrolled diabetes, these people shouldn't use the equipment, and we certainly advise them beforehand. And if they need to they get clearance from their doctor.
How long is this type of a program? So does it depend on how much weight you want to lose or how toned you want to be?
Well, you could, yes. Well, but the thing is, it's not recommended for more than twice a week, 20 minutes twice a week. Okay. Your muscles need some time for recovery. You basically, in a 20-minute workout, you contract all your muscles about 20,000 times, which is way more than you can do with a conventional workout.
And so if somebody comes into you, are they usually people that say, I've tried everything and I'm tired of going to the gym?
Well, that's one person, but the beauty is this works for everybody. In fact, there was a study that showed they wanted to see how elite athletes performed with this. And they found that even though these people were at the peak of their performance, their strength and their improvement was such that is someone who is not as elite as they were, is somebody who was just a amateur athlete. So this helps everybody.
Dr. Maggio, I'd like to. This is actually a question for myself because I have pulmonary limitation as a result of an occupational hazard exposure.
Okay.
And so one of the reasons why I don't work out is because I get very short of breath very easily, and I feel like I'm starting to wheeze right away.
Okay.
Would this be advisable for somebody like me with a pulmonary problem who may have limited ability to exercise?
Absolutely. So we can tailor your workout to what your needs are. You do not have to have so much. You don't have to exert yourself so much so that your pulmonary status won't be compromised. So we can do something a very light workout where you just do stretching, and that'll contract the muscles. So you get much more intense workout, even though you're not straining.
During this time of COVID, so many of our clients not only fell into depression, started feeling badly about themselves, relationships became compromised and stressed. Movement was limited because people were at home, they weren't going to work, a lot of them. So with that type of a lifestyle that is not perhaps the norm, would this program help, or the fact that people are eating more, sitting at home more, and their psychological well-being is compromised, would that almost not allow them to achieve the excellence you would normally see if we weren't in a COVID world?
So the beauty about Shotgun Fitness is that it's COVID proof. We actually started the business last January, and then COVID hit 2 months. So we had to kind of rethink ourselves. Basically, the way the system works is it's a handheld device that controls up to 10 suits. So you can take a suit, or up to 10 suits, 1, 2, up to 10, anywhere. So I could take one suit to a client's home. We can do this outside, properly social distanced. So this is totally COVID proof and ideal for the situation right now.
And if somebody is not following a healthy diet, do you then coach these people to also alter the, cheese doodles, etc.? You know how
Absolutely. So it's getting in shape is not only working out; it's also proper diet, proper exercise, getting the amount of sleep, drinking enough fluids. So it's really the whole thing that you have to look at.
Now, I just wanted to clarify something about what you said about a person wearing the suit at home. Does that mean you are going over to somebody's home?
Yes, we could take.
Okay.
Yeah, so we could get a trainer. A trainer could come to the house, and they can work out at the house.
That's wonderful.
So it's very portable,
safe and convenient.
Yes, absolutely. Each person wears an undergarment that they purchase beforehand, so that there's no body contact between the person and the suit. There's always a barrier, and then we spray the suits down afterwards with antibacterial solution, so that they're all sanitized.
What is the youngest age of a client that you have?
We probably don't recommend anybody under 16. So 16 is probably the youngest, up until whatever age, as long as they have no contraindications to doing it.
And so if somebody comes into you, do you do an intake of sorts?
So
Ask
we have,
questions? Yeah.
sure, we advise them. We have a lengthy consent form. Ask them certain conditions that shouldn't be, if they have certain conditions that should not be present if they're using the shock room equipment, and then we advise them. And we take it. With the level, the intensity, and the frequency of the shocks can be changed, so it's tailored by the person. Okay, even if we have a group of 10 people, everybody is custom. Their program is custom, and that can be changed. It can be intensified as they get stronger and as they get acclimated to the workout.
Now, my question, you said that you don't recommend more than twice a week treatment,
Yeah.
right?
So
Now, what if they're very like fitness buff and they want to do exercises in between? Do you recommend that?
yes,
Why?
they could do that. They could do their own exercises in between. It's not recommended to do this because you have a lot of muscle exertion with this. Your muscles contract many times, and you need time for those muscles to rest.
Mm.
Okay, muscles break down, and you need time for those muscles to rest.
This is actually a great exercise for people who are kind of lazy.
Yeah, it can be. It can be. Actually, you could put the suit on and just sit there, and you'll still get some benefit. We don't recommend that, but that can happen.
So, interesting question. In a world where everything is becoming a click of a button, everything's virtual, we order online, we don't go to stores anymore, right? So where did this come from, this idea of putting a suit on and sitting on your couch or sitting in your house and all of a sudden having a workout? It sounds like Jetsons.
Well, this. First of all, we're the first ones in New Jersey to offer this technology. This is very big in Europe. And we're dealing with a company in Europe to get these suits over here to make them available to people here in the United States. So hopefully we are going to be the first of a long
Provider, right?
Provider, yes, that's the word. Thank you. Provider of these suits. So we're trying to get it into gyms. We're trying a lot. We're trying to get this out there because it's really a great technology. And it really helps. And there have been many studies that have shown how it can increase muscle, decrease fat, and it helps overall with anyone. Anyone could use the suit.
One of the things that I focus on at the firm, in addition to matrimonial law, is international business development. And I was on the phone yesterday with a company in Poland who's looking to reintegrate their workers to come back into the workforce, to come back into the physical space, and how that's going to look with expanded childcare services and wellness services. I really see this as being something that's offered in corporate America during a lunch break or something.
Yeah, this is something that that's one of the goals we have, is to get this into corporations. And as this kind of evolves, we initially started this with having a gym. But then we realized that, once COVID hit, we realized that, we had to rethink things, and we're going to start offering it to gyms because they have a captive audience already. They have clients already, and they can, sell this to their clients. We were thinking about going to corporations. They can do this as a lunchtime workout.
Exactly.
And it's 20 minutes. It's 20 minutes. And, it's basically equivalent to a 3-hour workout.
How does this impact a cardio workout where we say that you need to keep your heart going the older you get? Is it the same as being at the gym running on the treadmill?
Well, if it depends on what kind of workout you choose to do with this. I could put this on and do a Zumba class. I could put this on and just do stretches. I could put this on and lift weights. So depending on what your core is or what you want to do, if it's a high intensity training or a cardio workout, this can be incorporated into it to build muscle at the same time.
That's my idea. I have a question. Many years ago, I would say about 5 years ago, I attended somewhere in Bergen County, also similar concept. They're closed now, but basically for 20 minutes, you go into these Nautilus machines, and they also work on the concept of muscle exhaustion. How is wearing a suit different and more effective than working out with the machines?
So when you work out with a machine, your brain is controlling your muscles. Your brain is sending the impulses. The beauty is that the muscles don't know where the impulses come from. So if they come from an outside source, I could stimulate them from an outside source and they'll still contract. Okay. So when you get exhausted, your muscles will still get exhausted, but it's much more of a different workout because the impulse are coming from external, and you're still getting the
So
workout.
it's more targeted in.
Yeah, yes, it's targeted. Yes.
Would they
What
still feel seen?
what happens if you do this, let's say for 6 months, 3 months, right? And then you stop.
You can stop. I mean, it's basically, it's not something that we recommend to do these workouts like haphazardly or intermittently. We recommend having them on a regular basis, either twice a week or once a week, and continuing them because you'll see the results. If you stop, it's like any other exercise routine. You'll just get back into the old ways that you had. The muscle will start to atrophy like normal, like it would with any workout.
For people that have had various surgeries that may
Yeah.
not be able to be on a treadmill or other machines, is this a safer way to work out?
It is. So you can tailor the workout. What the beauty of this is that you'll be able to get the muscle contraction because it's from an external source. If you were trying to do that and you had, say, a knee injury and you were trying to build your leg muscles, you wouldn't be able to do that. But you can still contract the muscles without moving the joint. So that's kind of the beauty of it.
Furley, you had a question. I'm sorry, I cut you off before.
No problem. I know we're both super excited because, like, when something is revolutionary and so new and so easy, it seems, right? We always want to know more. So obviously, we would like to know, when you have all of those contractions, do you also feel sore after that?
So good question. So we've had many people try this, and everybody's skeptical in the beginning, and they're like, well, how could this really work? And we've had people from the general public. We've had elite athletes come in. We've had sports figures come in and try the workout. Everybody is impressed with the workout, and everybody says the same thing, that they can't believe that they feel this way after the workout. They never thought that something like this could cause the results that they got. You do feel some soreness about a day or two afterwards, similar to like an intense workout that you would have.
Wow.
Weight loss. Okay, talk to us about weight loss. Everybody wants to lose weight for the new year.
So there was a study that looked at abdominal fat in women and the use of EMS suits, and they found that after a certain period of time, they did get fat loss. In fact, this technology is similar to, I don't know if you've heard of the M-Sculpt machine. M-Sculpt is a machine using electromagnetic stimulation. It's a cosmetic machine, and it helps to burn fat and build muscle. But it's targeted, and the cost of it is probably about $1,500 per session.
Oh, wow.
So it's basically the same technology, but it's through the whole body.
And what's the cost of this particular program when you're saying the other one is $1,500 a session?
So basically, we have different kind of membership plans. It's priced either per session or per plan. So it's anywhere from $60 a session, $75 a session, to 8 sessions. We're running specials, and I don't know the exact pricing, but it's probably about $400 or $500 a month for 8 sessions. So it's something that is part of a workout routine. It's like joining a gym. So
Is there a special price for when somebody needs to go privately to somebody's home?
We don't have that worked out yet, but yeah, if we have to take it into the homes, we have special pricing. Right now, anybody who listens to the show, we can give you a free session. We're located at 425 Springfield Avenue in Berkeley Heights. I could give you the phone number if you like. It's 908-263-7252.
Looking to Dr. Maggio, somebody's looking to join now in their mindset as they're planning their budget for the new year, and especially a lot of our divorcees who are now single moms and single women, and they really have to pay attention to every dollar that's spent. They're trying to be cautious. Second wave of COVID is here. We're nervous about spending money on extras. Should they be looking at a 3-month plan, at a 6-month plan?
I would do at least a 3-month plan, because you'll see some results. You'll see results. You'll definitely when I first used it, I saw results after the second time. So you really see a difference, because your muscles get a workout like you've never had before.
What kind of results did you see in yourself?
Well, I saw abs that I never saw before.
Dr. Maggio, how does this play with the vitamin therapy that you provide, which is, I'm a big fan of that. Your
So
shop room, along with the vitamin therapy, along with the healthy diet, how does that all work together?
we're also doing nutritional treatments or nutritional advice, and we're giving we have IV treatments. IV treatments help in building muscle. They help in burning fat. Also help for your immune system. So there are many different cocktails that we have that we can use, and we can tailor them based on what you need.
That's excellent. And I think in the world, Furley, you would agree, of all the guests that we have, everybody always touches upon stress, right? Whether you're a mortgage broker, a realtor, a lawyer, whomever, all our clients are feeling so much stress right now. And for you to take time out to get a vitamin treatment, an IV treatment, to start working out, that's probably the secret sauce to starting 2021 off on a good foot.
Yeah, any type of exercise helps burn stress or helps get rid of stress. Any type of exercise, you can get some endorphins going. Your stress levels will go down. So it's one of the things that a lot of people use to relieve stress.
Dr. Maggio, during a treatment, are you present there to supervise? I know that you're a medical director. And so are you there to supervise for any adverse reaction, for instance?
Well, we have everybody trained, our trainers. We have, our certified trainers. So they're equipped to deal with any urgent situation that occurs. They're all trained in CPR. Hopefully that never happens, but they're all trained in CPR. So I'm not there all the time because I have other duties, but everybody is trained. So our clients feel comfortable in knowing that everybody's trained in any emergency procedure.
Is there a difference? You mentioned that you could put the suit on and do a Zumba class. Is there a difference in results if you actually do physical activity with having the suit on versus standing?
Yeah, obviously you're gonna burn more calories if you exert yourself more. So somebody who has a cardio workout or a Zumba class, you're gonna burn more calories. The muscle contractions will be the same. So normally if you did a Zumba class, you wouldn't get really built muscles. So using the suit during a Zumba class actually increases that, and you get muscle stimulation and muscle contraction that you wouldn't normally get.
Is there a recommendation for people that are overweight? Let's say they fall to the obese category based on their body mass index and what their primary care physician says. Would you recommend that people drop weight before they start this, or this could be a way to lose the weight?
I would do it in conjunction. I mean, depending on how overweight you are, I would then recommend a tailored program to meet the needs of that client. Obviously, if somebody's obese, we're not going to put them on a Zumba workout right away. We would do something, we would kind of go light and then, tailor it to the person.
Okay. That's great.
Sizes, the suits.
I'm sorry?
The suits, do they come in sizes?
Yes, they do come in sizes. They do come in sizes. So we have something for everybody.
That's fantastic. Are you seeing a surge in people calling you because, the typical old adage of New Year's resolutions?
Yeah, well, now's the time where you get a lot of people looking to lose the pounds that they gained, especially with everybody being home and more sedentary. Nobody doing much anymore. Everybody's looking to kind of start a New Year's resolution.
Yeah. Carolina, what's really incredible about the Divorce Dynasty is we provide obviously the professionals in many different fields. Now, from what you're seeing right now, do people have lost self-esteem, confidence, and how do you see this powerfully changing the outcome of somebody who's going through a divorce?
Oh, well, I've seen, I'm sorry, was that for you or was that for me?
No.
So I've seen, we've shared a lot of clients together, and I've seen some women come in where their self-esteem is so low because of what they've gone through, and we do just a little bit to help them out, and just making them feel better, making them look better does so much for their self-esteem and their outlook going forward.
Furley, I've seen a lot of, more so since COVID, women coming out of the woodwork due to psychological abusive relationships. Obviously, we had an increase in domestic violence. Some people actually went through physical violence. But what we're seeing more so, especially in the more affluent towns, is somebody that's been suppressed for a very long time in a marriage, being told you're ugly, you're fat, you got old, look at you, I'm not interested in you anymore. And when Dr. Rich gets a hold of these people, coupled with the right therapy, coupled with the right exercise, coupled with the right education, it is incredible to watch people really just coming back to life. And if you don't come back to life, if you don't believe in yourself, then the process is overwhelming, because you're already told that you're not smart enough, that you're never going to make it, that no one's going to want you, that no one's going to hire you. So although I don't want us to come across as superficial, that if you get some Botox, some filler, you work out, all of a sudden life's wonderful. No, life will not be wonderful, but you will have the drive perhaps to start going through some of the more difficult issues, because divorce, as we've talked about fairly many times, is a death. Divorce is a death of a relationship, and you have to mourn it. You have to go through the stages of loss. And if you're feeling poorly about yourself, it's all the more difficult.
Exactly. I always say, because everything what we do in the divorce dynasty is very holistic. That's the whole point of it. We empower people out there, men or women, it may be. And it's beautiful that we are able to provide, because honestly, just a little to freshen up a little bit, and to actually help us with our confidence by feeling better, getting healthier, so we can actually embrace our new beginnings a lot with more resilience and confidence, is a really powerful thing. So I was actually very excited when we were going to have Dr. Maggio, because you don't only help people from a medical standpoint, you also help like in aesthetics. Can you talk about that a little bit? The services that you provide in terms of aesthetics.
Sure. Just to touch on what you were saying, I think just giving somebody the kickstart, and then just sometimes they need that little push, or they need that little tweak, and that gives them the self-confidence to go forward and kind of self-motivate. So, which is really, really a good thing. But at About Face, we basically do all non-invasive, non-surgical aesthetic procedures. We do Botox fillers, Sculptra. I do MediThreads, which is a thread lift. We do, what else do we do? We do cool sculpting, Fraxel, skin resurfacing. We even do Gainswave. Gainswave is
I was going to say, but I want to end the show with that. Everybody's going to be calling you now, so go.
Gainswave is a prescription a treatment for erectile dysfunction, a non-surgical treatment for erectile dysfunction. And we also do Votiva for vaginal rejuvenation.
So Carl, think about people now. Let's not be sexist, right? You have a man that's in a bad marriage, unhappily married, loveless marriage, wants to get back out there, but has such low self-esteem, has not been engaged with his wife, and for numerous reasons. But now, how do you get back out there? You feel that you are maybe overweight, you got older, you can't perform. Who's going to want to date you? How do you even start the process? Dr. Maggio, how does that work? Where do you begin?
Well, a lot of it is self-esteem. It's funny because, a lot of men, they judge their masculinity on their ability to get an erection. And once you can help somebody with that, again, it's like putting Botox in somebody's face. It's giving them self-esteem. And it's really amazing. And you can change people's lives either way. I mean, men or women, you can really help people by just doing a little bit.
Wow, beautiful. So before we end the show, could you share with us 3 powerful tips that you could share with our viewers on health and wellness?
3 powerful tips. Oh, this is a tough one. Everything in moderation. Okay. Everything in moderation. I think that,
consistent. The new year, and then by February, the New Year's resolution is gone.
That's right. So everything in moderation. Just get up, get out, do things for yourself, and visit your doctor once a year, at least.
I think that this is also the time to start thinking about breaking bad habits. I think one of the things that really drags people down is that they're engaged in either activity or relationships or mindset that is unhealthy. And until you break that pattern, right? They say, I think Dr. Maggio will agree that they say that you could form a new habit in like 30 or 45 days, but it takes consistency.
Right.
If you don't change or get rid of what's dragging you down, then you can't expect different results. And I think that if somebody signs up with you and they stick to it, they will break a bad habit of not working out.
Right.
If somebody reaches out to one of our therapists and talks through a problem, they'll break the habit of doing something that drags them down. So Divorce Dynasty this year is really going to focus on rebuilding and health and wellness, because although we will be divorcing people, our holistic approach, as Furley mentioned, is to help them rebuild their lives. That's really when the hard work begins.
Yeah, mind, body, and spirit. That's what we are. And it's like so amazing that we have somebody just like Dr. DiMaggio who's actually able to help, jumpstart our, health and fitness and, beauty, and also ability to be the best performer we have in whatever department in our lives would be, right? So here in the Divorce Dynasty, we are deeply committed to be able to help you in any which way we can. So Dr. Maggio, please give us a website. Where can we reach you?
Okay, so it's for Shockroom Fitness. It's www.shockroomfitness.com. The number is 908-263-7252.
Thank you so very much. Remember,
You're welcome. Thank you.
You get one free.
Yeah.
It doesn't get better than that.
That's
One
right.
session. Just mentioned the Divorce Dynasty. Carolina, any last words?
I just want everybody to know that we are going into the second week of January. It is not too late to set some resolutions for yourself and start making some changes. In fact, every day is a new beginning, and every day you could decide to live a better life, whether through Dr. Maggio or through anybody else on the platform. Never give up. That's my message for 2021. Never give up. And I could always be reached, obviously, on my cell phone, 973-309-4473. We have the best professionals on the platform to help you, and we are here to help you develop the next chapter. So, Furley, thank you.
Oh my goodness! Thank you so very much.
Thank you.
What a great segment this is. You know what I will say? Like Albert Einstein said, like the definition of insanity is doing the same thing over and over again, expecting a different result. The year has passed already. It's time to form new habits, new beliefs, new mindset. And we here at the Divorce Dynasty are committed to helping you move forward in life to live your best life.
Absolutely.
Okay. Until then. This is Furley Almonte along with Carolina Denhard, host of the D Word. Until then, stay well, stay healthy, live your life fully and gratefully. Bye-bye.
Bye.